channel Mis.Medicine. Today we will discuss about medical tests and their diagnosis. So let's start it. First test is Tzanck test. What is Tzanck test? Tzanck test is used to detect herpes, genitalia or varicella pemphigus vulgaris. Tzanck test is the examination of fluid from a bulla or a blister in search of Tzanck cells. Tzanck cells, which characteristic of varicella, is also known as chickenpox, herpes zoster, herpes simplex and pemphigus vulgaris. Next test is Frey test. Frey test is used to diagnose lymphogranuloma inguinale. Lymphogranuloma venerum or lymphogranuloma inguinale have synonymous names. It's also known as like climatic bubo, Duren-Nicholas Fevre disease, Poradenitis inguinale, and Stremos bubo is a sexually transmitted disease which caused by the bacteria Chlamydia trachomatis. Frey test was developed by a German dermatologist to identify lymphogranuloma inguinale, in which antigen made from sterile pus aspirated from previously unruptured abscess, which produce a reaction in the patient with lymphogranuloma venerum. Next test is Vidal test. What is Vidal test? Vidal test is serological test used to detect enteric fever or typhoid fever. We use this test to detect on the second week of the typhoid fever. Next test is Weil-Felix test. Weil-Felix test is an agglutination test for diagnosis of rickettsial infection or typhoid fever. Next test is Bonney or Marshall test. Bonney test done by two fingers are placed in the vagina and uretrovesical angle elevated. And Marshall test, bladder neck elevated with open Alice clamp on straining, absence of leakage of urine indicates the positive test. Next test is Binet test. It's also known as Stanford-Binet test. Is used to detect intelligence quotient or IQ level. The Stanford-Binet test is an examination to measure intelligence through 5 factors of cognitive ability. These 5 factors are fluid reasoning, knowledge, quantitative reasoning, visual spatial processing, and working memory. Next test is sweat chlorine test. Sweat chlorine test is used to detect cystic fibrosis, in which we use a small electric current to measure the level of chloride in the sweat. In this test, we use pilocarpine, which increase sweating, and then the sweat is collected on a gauze for 30 minutes, then wait in a waiting jar. If chloride is more than 60 milli equivalent per liter, then cystic fibrosis is the diagnosis. Next test is Ferrin test or nitrogen test. What is Ferrin test and what is nitrogen test? Ferrin test and nitrogen test is used to detect the leakage of amniotic fluid. Ferrin test. In Ferrin test, we take the sample of vaginal fluid on a slide and allow it to dry. Then we will look under the microscope. If crystal of liquor we see in the microscope, it's the Fern test. And in nitrogen test, normal vaginal pH is 4.5 to 5.5, but pH of liquid is 7 to 7.5. Put the nitrogen paper or vaginal discharge. Liquid turns the nitrogen paper deep blue. Next test is VDRL test. What is VDRL test? VDRL test is Venereal Disease Research Laboratory test which used to detect syphilis. May also be performed on cerebral spinal fluid samples in the diagnosis of neurosyphilis. Next test is VMA test. What is VMA test? VMA is vanillin mandelic acid. VMA is the value for elevation of hypertension. It diagnoses the neuroblastoma, ganglioneuroma and gangliononeuroblastoma. Next test is glucose tolerance test. What is glucose tolerance test? Glucose tolerance test is also known as oral glucose tolerance test, in which we measure sugar level in the body or glucose level in the body. The glucose tolerance test can be used to screen diabetes mellitus. Glucose tolerance test is used to determine diabetes mellitus or diabetes type 2. Glucose tolerance test is also used to diagnose gestational diabetes. Gestational diabetes is a type of diabetes which develops during pregnancy. Next test is glycosylated HB1AC test. Is also used to detect diabetes mellitus or diabetes type 2. Fluid deprivation test is also known as fluid deprivation test, is used to detect diabetes mellitus or type 2 diabetes. Treadmill or cardiac stress test is used to detect the heart function. It is a cardiologist test that measures the heart's ability to respond to external stress in a controlled clinical environment. Triple test is used to detect Down syndrome. Triple test is also known as triple screen, the Kettering test or the Bart's test. It is an investigation to perform during pregnancy in the second trimester to classify the patient has high risk or low risk for chromosomal abnormalities. The term multiple marker screening test or triple test. Next test is D-dimer test. D-dimer test is used to measure clot formation, and D-dimer test is a test which determined by a blood test to help diagnose the thrombosis. Next test is Adam test. Adam test is also known as forward bend test. Adam forward bend test is used in many situations to diagnose scoliosis. It is not primary source for diagnosis. This test is often used at schools and doctors' offices to check for scoliosis. The patient bends forwards as if they are dividing. Next test is Allen test. Allen test is ABG analysis used in physical examination for arterial blood flow to hands. Aldehyde test. Aldehyde test is also known as silver mirror test or tolerance test. Aldehyde test is used to detect leprosy. Tolerance test is a qualitative laboratory test which is used to distinguish between an aldehyde and a ketone. It exfoliates the fact that the aldehydes are readily oxidized, whereas ketones are not. Tollens reagent oxidizes an aldehyde into the corresponding carboxylic acid. Next test is Lepromine skin test. Lepromine skin test is used to detect type of leprosy. It involves the injection of standardized extract of the inactivated leprosy bacillus under the skin. It is not recommended as a primary mode of diagnosis. Next test is Chopra test. Chopra test or aldehyde Chopra test used to detect Kala Azar. Chopra test is also known as urea stabamines test. Formation of white ring at the interface indicates positive reaction. White ring. Next test is phosphate test. Phosphate test is used to measure the level of phosphate in the blood. Phosphate is a chemical that contains the mineral phosphorus. Phosphates are essential for the production of energy, muscle, nerve function and bone growth. Next test is patch test. Patch test is used to detect allergic reaction. Patch test, a test to discover whether a person is allergic to any of the substances which are applied to the skin in light scratches or under a plaster. Next test is Tourniquet test. Tourniquet test is used to detect dengue. A tourniquet test, it determines capillary fragility. It is a clinical diagnostic method to determine a patient's hemorrhagic tendency. It assesses fragility of capillary walls and is used to identify thrombocytopenia. Thrombocytopenia. The test is a part of WHO algorithm for diagnosis of dengue. Next test is urea breath test. Urea breath test is used to detect Helicobacter pylori, which is a spiral bacterium implicated in gastritis, gastric ulcer and peptic ulcer disease. It is based upon the ability of Helicobacter pylori to convert urea to ammonia and carbon dioxide. Next test is Schick test. Schick test is used to detect diphtheria. Next test is Dick test. Dick test, a test to determine susceptibility or immunity to scarlet fever by an injection of scarlet fever toxin. Test is Rothera test. Rothera test for ketone bodies in urine. Rothera test used to detect acetone in urine. Next test is Hay test. Hay test is used to detect bile salts in the urine. Hay test is also known as Hay sulfur flower test. Hay sulfur flower test is used to detect bile salts in the urine, which allow the sulfur powder to sink. Next test is Smith test. Smith test is used to detect bile pigment in urine. Hay test for bile salts in the urine and Smith test is used to detect bile pigments in the urine. Pigments and salts. Hay test for bile salts and Smith test for bile pigment. Next test is arthrocentesis. Arthrocentesis is used to detect joint inflammation and swelling, in which we use syringe to collect synovial fluid from a joint capsule. It's also known as joint aspiration. Arthrocentesis is used in the diagnosis of gout, arthritis and synovial infections like septic arthritis. Next test is dexamethasone suppression test. Dexamethasone suppression test is used to assess adrenal gland function by measure how cortisol level changes in response to an injection of dexamethasone. It's used to diagnose mainly Cushing syndrome, and it also used to detect adrenal gland and pituitary gland tumor. Next test is Holter monitoring. Holter monitoring is a type of ambulatory electrocardiography device, a portable device for cardiac monitoring for at least 24 hours to 48 hours. Holter monitoring is 24 hours ECG monitoring in dysarthria. Next test is pulmonary function test. Pulmonary function test is used to measure lung volume and capacity by spirometer. Pulmonary function tests are non-invasive tests that show how well the lungs are working. The tests measure lung volume, capacity, rates of flow and gas exchange. Next test is SGDT and SGPT, AST, ALT. SGPT is for ALT and SGDT for AST. SGPT or ALT, ALT is alanine aminotransferase. A blood test is when a sample of blood is taken from the body to be tested in laboratory. Blood test can help them to see how well and organs are working, like liver, kidney. ALT-AST test is used to measure liver function. Next test is Pap smear test or Papanicoalo test is used to detect cervix cancer. The Pap test is a method of cervical screening used to detect potentially precancerous and cancerous processes in the cervix. Next test is creatine clearance test. Creatine clearance test is used to detect estimation of glomerular filtration rate. Creatinine is a waste product from the normal breakdown of muscle tissue. The kidney's ability to handle creatinine is called the creatinine clearance test, which helps to estimate the glomerular filtration rate, the rate of blood flow through the kidneys. Next test is Wood's light examination. Wood light examination is used to detect superficial infection of skin. Wood's light examination is a procedure that uses trans-illumination light to detect bacterial or fungal skin infections. Next test is Burrow ink test. Burrow ink test is used to detect scabies, or it is a itch test. Next test is Braden scale. Braden scale is used to measure integrity of bed sores. Braden scale is used to help health professionals, especially nurses, assess a patient's risk of developing a pressure ulcer. Next test is Macaulay test. Macaulay test is used to detect achalasia. Next test is Gold quantiferin test. Gold quantiferin test is used to detect tuberculosis. We can detect tuberculosis by the help of tuberculin skin test. Tuberculin skin test is also known as Mantoux test. Next test is Bengal test. Bengal test is used to detect protein energy malnutrition. Next test is Tanzilin test. Tanzilin test is a pharmacological test used to diagnose of certain neural diseases, especially myasthenia gravis. It also used to detect myasthenia crisis from a cholinergic crisis in individuals undergoing treatment of myasthenia gravis. Next test is Romberg test. Romberg test is a test of the body's sense of positioning, which requires healthy functioning of the dorsal columns of the spinal cord. The Romberg test is used to investigate the cause of loss of motor coordination. Next test is knee kiss test. Knee kiss test is used to detect meningitis, especially in children. Next test is Trendelenburg test. Trendelenburg test or Brody-Trendelenburg test to determine the competency of the walls in the superficial and deep veins of the legs in patients with varicose veins. Next test is Fallen-Ortelen test. Fallen-Ortelen test is used to detect carpal tunnel syndrome. Next test is hanging drop test. Hanging drop test is used to detect cholera. Cholera is an infectious disease that causes severe watery diarrhea, which can lead to dehydration and even death if untreated. It is caused by eating food or drinking water contaminated with a bacteria called Vibrio cholerae. Next test is bunnel test, or bunnel test is also known as heterophile antibody test or mononuclear spot test or monospot test. A form of the heterophile antibody test is a rapid test for infectious mononucleosis due to Epstein-Barr virus. Next test is shake or bubble test. It is a simple, rapid method for estimation of fetal lung maturity. The chances of survival of a prematurely born fetus depends much on the degree of maturation of its lungs and its ability to avoid developing respiratory distress syndrome (RDS). Next test is Rubin test, is also known as Isidore-Clinton-Rubin test, is used to check tubal patency in the infertility investigation. Next test is tape test. Test is used to suspect pinworms. Next test is Ortho tolidin test. Ortho tolidin test is used to detect the presence of both free chlorine or chloramines in water. Next test is Dexa scan. Dexa scan is used to detect bone metabolic diseases like osteoporosis. Next test is heel to shin test. This test is used to detect body coordination. Next test is halo test. In radiology, the halo sign is a finding of a dark halo around the arterial lumen or ultrasound that suggests the diagnosis of temporal arthritis. In nursing, the halo sign is the result of a test to see if drainage from a head injury contains cerebrospinal fluid. Next test is Benedict test. Benedict's reagent is a complex mixture of sodium carbonate, sodium citrate and copper sulfate pentahydrate. It is often used in place of Phallic solution to detect the presence of reducing sugars. Benedict test used to detect urine in glucose. Next test is Renne and Weber test. Renne-Weber test is a quick screening test for hearing. It can detect unilateral conductive hearing loss and unilateral sensorineural hearing loss. Next test is Quame test. Quame test is a skin test used to detect sarcoidosis. Direct comb test. It is a hemolytic test. Next test is Schiara test. Schiara test used to detect color vision. Next test is Snellen chart test to diagnose distance vision. Next test is confrontation test, is used to detect central and peripheral vision. Confrontation test is also known as Jones test. Next test is Giagard's type card test. The Giagard chart is an eye chart used in testing near vision acuity. Next test is Schiling test. Schiling test is a medical investigation used for patients with vitamin B12 cobalamin deficiency. The purpose of the test is used to determine how well the patient is able to absorb B12 from their intestinal tract. Next test is histamine test. Histamine is a substance that is released from specialized cells called mast cells when they are activated, often as part of an allergic immune response. This test measures the amount of histamine in the blood or urine. Is used. Histamine test is used to detect leprosy. Next and last test is rollover test. Rollover test is used to detect preeclampsia. Preeclampsia is a condition that occurs only during pregnancy. Some symptoms of preeclampsia may include high blood pressure and protein in the urine occurring after week or 20 of pregnancy or second trimester. Eclampsia is often precluded by gestational hypertension. 5 ways to help prevent preeclampsia. First, maintain a healthy weight. Second, get regular exercise. Third, eat a healing diet to reduce blood pressure levels. Fourth, prevent dehydration and fatigue. Fifth, keep up with doctor's visit.
Thank you for watching. If anyone want any test in detail, then you can comment in the comment box. Thank you.